I first started, patients came to doctors and the doctor told them what to do and they took their medicines and went home. And that's the last thing that happens ever today. In fact, the world is better than it was years ago because we now understand it's important to integrate the patient's view of what's going on and how they feel about their treatment into their plan. And so everyone comes in with information, more than they had before. Everyone comes in with core beliefs about what they want and don't want, and there are more choices for treatment. So I think it's critically important that we express the dignity and respect by having the patients communicate to us what they're interested in, what their hopes are, what their goals are.
Dignity and respect is, I think, a really important core principle in terms of the Patient Family Advisory Council. We show respect and dignity to our patients and families in many ways. We allow patients to bring a significant other into the exam room with them for an appointment. In the hospitalized setting, we encourage patients and significant others to be part of the care. We have bedside rounds so that the clinicians can actually speak to the patient and family, setting goals of care, trying to make sure that they understand what the treatment options are, that everybody's on the same page. And it's a way that we connect with human beings on a very personal level. We respect their beliefs. It may be cultural, it may be spiritual or religious beliefs. When patients are admitted to the hospital, one of the first things we do is assess what their preferred language is. It's important for them to be able to understand the treatment decisions, information about their medications, and their dietary preferences can be respected. We can, modify their diet according to what their particular needs are. And we try to be very flexible with visiting hours, so again, that they can have the support that they need while they go through the cancer journey.
My name is Kim Hegrich, and I am a 6.5-year breast cancer survivor. Part of Patient Family Centered Care is a collaboration with the institution, and at Fox Chase Cancer Center, we really have an opportunity to provide valuable input from a patient or family member's perspective. And the Patient Family Advisory Council is made up of patients, family members, and staff from Fox Chase Cancer Center. Patient Family Centered Care, to me, is working with the patient. It's a collaborative effort between the physicians, the nurses, the patients, their families, a true partnership.
I came here about almost 29 years ago as a brand new nurse, and I've always been very much a patient advocate. Then I became a patient myself. And I realized that the patients need more of a voice, and PFAC is a way for the patients to have a voice. Yeah, the meetings can be very interesting because as a patient you see a view one way, but as a nurse here, another view. So trying to meld the two can be a challenge, and helping the patient members of PFAC understand what can be an obstacle to some of their ideas and how can we work around it. It can be a welcome challenge because you want to make good changes.
What patient and family-centered care means to me is that I had an active role in my wife's care. I wasn't sitting on the sidelines, and I took an active role in her care both here and at home. And now that I'm working on the Patient Family Advisory Council, I'm working alongside the doctors and the administrative staff, and they're listening to what I have to say about the things that I saw while I was a family member here.
It's been my privilege to sit on the Patient and Family Advisory Council, or PFAC as we call it, as a staff member. You learn much about the patient experience, listening to the stories. All of us in healthcare strive every day to provide the best experience for our patients. Fox Chase has dedicated itself to really listening to the patient voice through the PFAC and has made considerable changes in many departments over the last 5 years. The leadership at Fox Chase embodies the slogan, "Nothing for us, about us, without us."
PFAC is an outstanding part of Fox Chase Cancer Center. We have believed in patient and family-centered care ever since our founding over 100 years ago. But with the national impetus toward patient and family-centered care as a particular responsibility of the board of directors and the senior leadership of an institution, we've embraced that and created this council. I enjoy being on the committee. I listened to the committee members as they look at the ways that they are treated, want to be treated, the way that they expect the sort of respect and direct one-to-one communication and support. And from that, they develop individualized projects and project ideas and bring them to the PFAC for prioritization and then to senior leadership at Fox Chase for implementation. They also work with us on developing lay language for treatment protocols and consent forms. We use them as a focus group for activities like our new website development and things that we're doing in the areas of clinical research.
Almost no one comes in who hasn't been on the web and looked up what they think they have, whether they have it or not, and read all kinds of articles. And it's really very difficult for the patient because, in fact, much of the information is written at a level that's difficult for a patient to understand, sometimes even for the doctor to understand what they're saying. But it's a tough problem. So they have a lot of information, but what they don't have is the experience to integrate it. So we have to put things in context. And I think that's the biggest things we do through the informed consents, through the various participation that we have with the patients and with the families. And so I can't imagine ever getting out of a room without saying, have we answered all your questions? Are there things you don't understand or want to talk about more?
I'm Joan Kavanaugh, and I'm a PFAC member. I was treated at Fox Chase 18 years ago. This is where I had my chemo for my breast cancer. The Patient Family Advisory Council is a committee of the hospital that meets once a month. A lot of us are ex-patients or family members of ex-patients. One of the ways that PFAC can contribute to Fox Chase is that we can bring our input to help just plain competitiveness of the hospital. And I think that we're all concerned with, patient referrals and getting good volunteers. And, this is one of the ways that you can do it, is having excellent, customer service and compassionate care. Make sure that we have an input as often as possible.
Since our kickoff of the Patient Family Advisory Council, we've had the opportunity to bring patients and family members not only around the table for our council, but also have invited them to participate in our hospital committees. They've been engaged in some of our improvement activities. They've been involved in educating us on what questions we should ask when it comes to designing care for them. We've had several initiatives to enhance how we deliver care to our patients, and it's been very beneficial.
I think that the most important thing in the patient-centered care is the patient-physician relationship. This relationship starts really from the first time you meet a patient, and something that I hope it grows over time. Patients are encouraged to participate in the care because we know that when they participate in care actively, the outcomes are better.
As a Patient Family Advisory Council member, I have the opportunity to directly influence policy at Fox Chase Cancer Center. For instance, we are currently working on the visitation policy and the Patient Bill of Rights, and I feel it's important that you have a patient's perspective since it directly impacts us.
I think a major difference in healthcare is that it's not all about the convenience for the clinical staff. We're really partnering with families in a very different way now to really make sure that the approach to care and to how we create the environment is patient and family centered. So it's been a real paradigm shift in healthcare, and it's challenged us all to think very differently.
I think it's clear from the national level on most of the organizations I belong to, and even now down to the individual centers and programs, that patient advocates are almost always included in the decision-making process. Patient advocates are present in the grant review processes. Patient advocates bring a different view to construction and facilities, and this is a valuable contribution. The buildings and the research programs are about taking care of the patient, so by asking them what their views are, we're going to get a lot closer to being able to accomplish what we need.
The advice that I would give to a patient and family member coming in here the first time is not to give up, because you have a hospital full of people who want to see you walking out of here a survivor.